the scheme brings together, obviously, the patient focus of the health research charities, which is essential, and the funding expertise, obviously, of the Health Research Board. And what I love is that I'm told it's one of a kind internationally, this scheme and the way the scheme is set up, and that there are countries around Europe looking enviously on. So it's fantastic to see. The department first dedicated funding to these awards through the HRB quite some time ago, it was 2006. And there have been 134 research projects supported worth €27 million, 13.5 from the HRB funding matched by the charities. And the scheme has long been incorporated, obviously, in the core funding of the HRB. The scheme isn't limited to rare diseases, but the rare diseases community has been very much involved and has, I think, particularly benefited from it. And for many small charities, the joint funding scheme has often been the only route to fund research into a health condition. The many charity members may have been touched by personally. Certainly, I have come to know many people who've been involved in these charities, who are involved in these charities. And a lot of the time it has come from personal experience, a family member, a friend. And for the larger charities, the scheme has doubled the funding they could have generated alone, which obviously is fantastic.
I suppose the 50-50 aspect of this, it makes it so much more feasible. ASI is a charity, and there are so many well-deserving projects that we would just love to fund, but we're limited. And so, but this really is excellent value for money for us. The fact that, it's 50% coming from the HRB and 50% from ASI, it's so much more feasible. And we're really excited about it.
A really important partnership, actually, for the HRB. It speaks to a number of values that we hold very, very dear, and that are going to be reflected in our next strategy, I hope, very, very clearly. And that's obviously around the quality of the research that we fund, and we're very committed to funding quality of research, but also about collaboration and working in partnership with people both nationally and internationally. And just generally being responsive. So being responsive to the needs of people and the needs of patients and the public, and the needs of the research community as well. And also to being inclusive. So it's really, from our point of view, an excellent partnership. And of course, people know we've a very strong commitment in the HRB to public and patient involvement, and we've been promoting that message for quite a while. So it speaks to all of those things, and for that reason, we value it enormously.
I mean, Breakthrough is a national charity, but we're 100% funded by donations and fundraising done. So Breakthrough are really happy that we can leverage extra funding. So we're actually doubling the value of any donation that is being made to Breakthrough through partnering in this type of scheme. But equally, HRB are doubling their investment in research. So that is very important as well.
With a little bit of advice for any researchers interested in applying in future years. So if you don't already have a link to a charity, have a look at the membership page of HRCI and see if there are any charities in a relevant area. There may not be, but if there are, we'd encourage you to reach out early. Even if they don't have funding for the next round, those conversations can be really helpful in building the relationships going forward. Also think about the patient and public involvement, the PPI, early, as that will be assessed by the decision-making panel. And also to say, and I'm going to be blunt here, if you're not intent on really making a difference to patients through your research, this is not the scheme for you. Our member organizations understand very well the importance of career progression and publications and conference presentations, but ultimately their focus is to make a difference for patients. And unless you've worked in a charity, it really is hard to understand what a tough and relentless job fundraising is. So every euro really does need to be put to good use towards patient benefit. On the flip side, if you want to make sure your research has real world value, then there's no better scheme than this. Your research will be funded in the context of what a charity has deemed important to the people they represent, and your connection with the charity is also likely to add value for your research in numerous ways.